We're back on To Your Health. I'm Dr. Bruce Bonanno. Migraines are more than just a simple headache. More than 24 million Americans deal with serious migraine-type headaches that can have intensified pain, sensitivity to light and sounds, and experience bouts with severe nausea and vomiting. Joining me now on the show to talk about headaches and the treatment in general are Dr. Behin. Did I say it right?
Behin.
Behin. And a patient of his, Barbara Krieger. Welcome to Your Health.
Thank you for having us.
Now, we're talking about headaches. So many people have headaches. I see them all the time coming to the ER. Probably the one people most refer to is migraines.
Yes.
Now, when people tell me, they say, oh, I have a migraine, they just mean a severe headache. But migraine is not just a severe headache. It's a specific type of headache.
We have two kinds of migraine. One is migraine with aura, that is blindness of the eye, blind spot, and flashing light that start this way, but after half an hour it becomes severe headache, and it's very difficult to live without any medication. The other kind is migraine without aura. That is usually severe headache. It can be one side or both sides, and it can be with intolerance to bright light or intolerance to loud noise, and usually it gets more severe with physical activity.
And there's many other types of headaches that we don't have to go into. There's tension headaches, there's cluster headaches, there's post-traumatic headaches.
That's right.
Now, Barbara, what kind of headache were you diagnosed with? You suffered from headaches for how long?
I would say 10 years, but the last 3 or 4 years were horrible.
And what were doctors telling you? What kind of headache was it?
Well, they did tell me it was a migraine headache, but I went through a lot of stages until I was told that, because I had flashing lights, which could be a sign of MS. But in the end, it was migraines. I was very nauseous. My eyes hurt. I couldn't tolerate the light, and it was just horrible. I was sick more than I was well.
Now, migraines usually are diagnosed by exclusion. It's by the history of the patient, the physical symptoms that they're getting, but basically ruling out all the other kinds of headaches.
Exactly. According to International Headache Society, you have to rule out at least 9 other diseases before you can say it's a migraine headache. And interesting enough, Barbara's headache was on one side only. It was in left side.
That was the most interesting part of it. I used to say to each doctor, I could draw a line down my face. This side is normal, and this side is completely numb, or it hurts, to the fact that my whole left side of the body hurt, and because the pain was radiating down. And that was when it got to its very worst.
And that's many times, that story is almost typical to migraines, the one-sided. Now, in
Yes.
Barbara, we have a picture here. Can you show us what was different or what you found with her headaches?
This is a coronal view of a skull.
It's a cut through straight
It's a
up
cut
and
through
down.
straight up, down, if you cut somebody like this. And this medial wall that is in the nose, it's called septum. This is middle turbinate, this is middle turbinate, this is inferior turbinate, this is inferior turbinate. These small cells here are called ethmoid cells. When you look at these pictures, there is always space between this wall that is wall of the ethmoid and the septum, and this wall that is wall of the ethmoid and the septum. If by any chance there is little space here and these two walls are pressing against each other, that is the time that can cause headache.
Now, we have x-rays of Barbara.
Yes.
We can put those up on the screen, and
Yes.
maybe we can, same thing, you can see people, describe them for people,
Okay.
what's up there.
If you look at the Barbara's x-ray, you see that at the left side, way up near the base of the skull, there is a ethmoid cell that is pushing against the septum. And it's hard to believe, but it's true. That was the only part that was abnormal in Barbara's x-ray. Her sinuses were normal. Everything else was normal.
And this is the second shot, I guess?
This is the second shot, and exactly the same thing again.
Okay. Now, I guess what led you to do these in Barbara? Was it just she wasn't getting help from any of her other treatments?
There is a known fact and known syndrome that is called contact point headache syndrome. And because of this happened about 20, 25 years ago. It started with middle turbinate headache syndrome. Middle turbinate was pushing against the septum and causing the headache. But after a while, when I was doing that, I noticed that some of the patients have contact point and pressure point way above middle turbinate, and I started to separate those walls and release the pressure. And I found out that most of my patients, at least 90% of them, they got rid of their headache.
Now, Barbara, what, I guess, led you to the doctor? I mean, is it this thing that headaches were getting more severe? Were they just not working? Were you getting sick and tired of them? Did you look for some other treatment? Did you hear about it? How did this work?
Actually, it was all of the above. I was sick of having headaches, being nauseous. I could not stand the feeling of one side of my face feeling different than the other side. That alone was, annoying.
How often were you getting them, first of all?
That was permanent.
Okay.
But the headaches, I would say every other day. And I went to neurologists. I went to, what are the eye doctors that?
Ophthalmologist.
Neuro-ophthalmologist.
Okay.
I was told I had an aneurysm. And then somebody recommended Dr. Behin to me. And I said, I'll go to any doctor. And some doctors will make light of it, like go see a psychiatrist. He was wonderful, and ever since I had my surgery, I have been fine. I've never had a numb face. I'll get an occasional headache like anybody else, or because you're stressed out. I have 3 children, so you can understand that. But it's nothing like it used to be.
Now, Dr. Behin, in her case, or in most of those cases, is this the first step you take? Is the X-ray? Do you do CAT scans? Do you review all the other records?
First of all, I examine the patient. We get some question answered from them, that how often they get the headache, how the headache is, which side of the head is it. Is it related to TMJ or is not related to TMJ? Is it related to the neck or is not related to the neck? And then if I feel that it is related to the nose and sinuses, I send them for CAT scan of the sinuses. And I see the CAT scan with the patient in my office, preferably when they have the headache without any medication. Then I shrink down the mucosa inside their nose with medication, and I numb that area that is contacting and causing pressure. And most of the time, their headache either disappear for a few hours or lighten up. And this is a good test that we know if we do the operation, their headache will disappear.
So that's really a great test done right in the office to find out if somebody may benefit from the surgery.
And it doesn't hurt the test.
And the test doesn't hurt.
You had this test in the office.
The test does not hurt at all.
You found immediate relief when he did this test?
Yes.
Great. And how long did it last for?
The numbness wore off, and then I was back to my situation.
But was that 30 minutes, an hour, that temporary benefit?
Temporary, like a couple hours.
Okay, great.
Sort of like having Novocaine. But I went through the phases also, like you mentioned, TMJ. I mean, I had a spinal tap for MS. I had so much that when somebody said, go to Dr. Behin, I said, I have nothing to lose. And I won because I'm back to normal.
How frequent do you find this? I mean, you said you'll try this test, and does it work 50-50? Do you have any kind of statistics on that?
I have not statistic on how many patients that have migraine or headache have this problem because I'm not headache physician primarily. I'm otolaryngologist. But
ENT for you out there,
ENT.
you know that big word.
ENT. But a while ago I decided that when a patient comes to my office, one of the questions that we ask is, do you have headache? And you will be amazed how many patients say yes, but this I think it's natural for me. I have it. And when I suggested that I may be able to help you with your headache, they were happy. So they continue having the follow-up visit and the CAT scan and came to my office. And now I have many more patients as a referral patient from the patient that had headache before.
Okay, Dr. Behin, I guess people now that they know, they might want some further information. Is there a number where they can reach you?
Yes, my telephone number is 201-659-4706, and there is a hospital telephone number, Christ Hospital,
Okay.
201-795-8200.
And is there any website?
Yes, I have a website that I guess will be connected to your website.
That's right.
But it's easy to remember, www.headachesurgery.com.
Well, I want to thank you very much. Barbara, thank you for coming.
Thank you for having
You're
us.
welcome.
And
Thank
glad that
you.
your surgery worked.
Thank you.
Thank you.
We have to take a short break, but coming up next, New Jersey is making an effort to help people with disabilities get back into the workforce. We'll tell you all about the New Jersey Wins program when To Your Health continues.